Well, as we get older, it is common, especially for men, to begin losing hair. For women, it's more about thinning hair, but for both genders, it can be frustrating and downright heartbreaking. This morning, our daytime doc sits down with a special guest to learn about some products that can actually help.
Thanks. It's great to be here at Performance Medicine today. I want to introduce Kelly Rogers, who's my daughter. She's also my lead esthetician that's been working with me for years on this. As you know, at Performance Medicine, we do a lot of work with hormones, and we're going to talk today about hair loss, especially in women. Hair loss is a very concerning thing, especially to women, and as they get to be menopausal, or if they had thyroid problems like we talked about last week, they really can suffer a lot of significant hair loss. Kelly, in working with women, obviously they're concerned about hair loss. How often do you see this?
One in every 2 to 3 patients are concerned about their hair, just either thinning or dry, damaged, falling out. And normally they either have a thyroid issue. I send them to you, and then it's good to just put them on a hair system after that to get that hair, start to regrow and recharge.
So the first thing we do is evaluate their hormones and also stress. I think that stress can cause a lot of problems with hair loss. Deficiencies in zinc, low iron can certainly cause it. When a woman especially becomes menopausal, the estrogen levels drop, and hair loves estrogen, especially. There's a lot of vitamins that I'll recommend, of course, biotin being the top one. But tell me about this new hair loss system you have.
Well, this is by Ducray, and we have the anti-caps here and a shampoo that just puts vitamins back in your hair, helps revitalize it. We've got a system for men and women. We've got a system for thinning hair, just around the scalp area, and then we've got for occasional hair loss, which if they've been on a diet or they just had a baby, they lose their hair, or a traumatic event, we've got a system for that with this Ducray line. And we've got a men's alopecia and women's alopecia for just male, female pattern baldness. So
you find it's very effective. I've had a lot of good feedback from your program.
Yes.
So the word is really to get evaluated to try to find the root cause of the problem. Our whole business is based on finding the root cause of a problem rather than just writing a prescription for it. So nutrition comes into play, certainly. Stress comes into play. Probably sleep patterns come into play, and then definitely hormonal status. But what I've found out is that really, if you're losing your hair or you're getting thin, it's a sign that something's going wrong. It's not a normal way of aging. Even with prematurely gray hair, I find a lot of times that's almost a hormonal problem as well, sometimes with a growth hormone. But I'm very excited about you working with these people. We've had great feedback so far.
It is a great system, yes.
But thank you. We're going to try to talk about this hair loss in further detail at times. With men, which is more my specialty with hair loss, it's very hard to get a man that's really bald on top to grow any hair back. I've seen some of it, but I definitely put them all on zinc, and I look at their testosterone levels, and also if they're converting testosterone to dihydrotestosterone in men. I probably see more women coming to me with thyroid problems and hair loss, but there's a lot of stuff you can do to make your body great again. That's kind of our new motto.
Yeah, send them to you, and then send them to me, and we'll customize their hair program. So.
Thanks, Kelly.
Thank
you, and we'll take care of any of your problems at performancemedicine.net.
The preceding portion of Daytime was sponsored by